I want my health care discussion to be between myself and my doctor with nothing out of Washington. Could you address that? Because I think that really hits at the heart of all this.
There is absolutely no disagreement on that point. None.
What you're doing here is, what the proposal here is to encourage people to have that conversation with their doctor.
Well, that's not true. That's not what the president stated on the.
No, the president. I watched the president that day, and I found myself in disagreement with a couple of things that he said on that issue. And then can I tell you, the legislation, though, right, sir, but the legislation we marked up in the Ways and Means Committee has the provision as Mr. McGovern and I have just described it, and that's where I think we should end up.
I wonder if these people
So
in the same world.
there are
Company gets between me and my daughter
so there are
every single day.
a couple of questions about existing state plans. In addition to the, I think the question was about existing Medicare. What effect are the recent budget cuts going to have on the state's prescription advantage drug program? I think there's an issue really is generally about preserving things people like in the state plans. So that's a question.
I can't speak to that with specificity because I don't know what the strategy is or the focus will be from the state level, but I will say this, that we have tried very hard to avoid making anything more complicated at the state level here in Massachusetts. And in fact, I think in fairness, it's a good point to all of you, and that is we have used the idea of universal coverage here in Massachusetts as a model as to how we get to better care.
So another very thoughtful question, and I think this is I think it's maybe a research question, but at what point will we factor in changing human behavior, becoming responsible consumers who make good choices and live healthier lives? Broad-based financial assistance will only increase dependence on government. Do we need higher deductibles with a deductible level based on income level?
That's actually a very significant question. So for those who, look, obesity in America is a massive problem. And I don't mean to put that in terms of a pun. It's a choice, though. It is a choice, but can I say something to you again? We pay for it in the end.
Right.
That's the point. No, please. That individual who loses their job and they end up in the emergency ward because they're being treated regularly for diabetes, please don't kid yourself. We're all paying for it. If that individual had health insurance, if that individual were encouraged at an earlier juncture of life to make better choices about obesity, encouraged to take up exercise, encouraged not to smoke, encouraged to limit drinking. There are a series of...
Let me just say one thing. Let me just say one thing. One of the surest ways to control and to reduce healthcare costs is to keep people well. And so if everybody thinks it's a joke when we talk about the need to kind of stress wellness at an early age, you know, what you're doing is you're part of the status quo, which means that no one's asking you to pay for anything. What we're asking people to do is to encourage, better behavior, to actually take preventative medicine seriously, because we're paying for that right now. And you're kidding yourself when you think it's a joke. It's a very, very serious issue.
Okay, this is a question that we recognize from websites, but I think there were a couple of spontaneously written ones in the same vein, which is essentially saying why rush to a large-scale fix at this time versus incremental or pilot type approaches.
I am when we talk about incremental changes, I am a veteran of 1993. So this is hardly a rush. I was on the Ways and Means Committee in 1993, and we had trouble in those days trying to get out a health care bill because it was very difficult to explain. And I think that what President Obama has done is he's tried to act as an architect in this instance, and he's encouraged the Congress to serve as sort of the construction team. Now, in 93, I think it should be noted, and they would be the first to ascribe to the statement I'm going to offer, in 93, there were a lot of special interests in the country who set out to kill the legislation, and they succeeded. Those groups are not out to kill this bill this time. They want to figure out how to be included in the bill, which I think is a good idea. Recall here, AARP is supportive of this legislation. The American... I'm tempted to say I only do a solo, but I don't think I can get away with it. In addition, the American Medical Association has endorsed the plans that are moving forward. And in addition to that, the American Hospital Association, they've endorsed the plans. That is entirely different than 1993.
So another different personal perspective. As a small business owner, I already pay about 15% payroll tax. Under the House draft, because I don't pay or can't afford to pay full health care, I will get hit with an 8% penalty. I will need to lay off staff positions. I think you get the gist of it. I can't read the rest of it.
I'm going to suggest that Belle Borkman, who's done a great job on this, if she would take a look at this question. She's a tax specialist, and you'll get a very accurate answer to the question.
Belle, you've been hiding there.
I wish I could be hiding. I think I'm looming large. No, the actual situation that's described there, the small business's contribution level would go down. If that small business owner is currently paying 15% for healthcare today, they could of course continue in a reformed market that gave them greater purchasing power, and depending on the characteristics of their employees, even gave them additional tax credit assistance. But depending on what their overall payroll level is, they might be exempt from the requirement altogether, or they might be subject to a lesser amount. But if they wanted to no longer pay 15%, they could opt to just make the 8% contribution or less, depending on the size of the business, and their employees would be able to seek assistance in the exchange and get qualified, high-quality coverage through there. So in fact, it sounds like under that situation, the person would save money.
You misunderstood the question. It was my question. If I could just follow up, please. I cannot afford right now to pay a match on health care that I do provide on 100% employee pay. My payroll is over $400,000 under the federal guidelines under the proposed bill. Therefore, if I continue offering a plan that the employee pays for, my understanding is I'll get hit with an 8% penalty. The 15% is already just general payroll tax. So how would that affect me?
I think that the levels are increasing. Right now, I think we're probably, the members will still have to decide this, but moving toward a pure exemption for firms under 500,000 with a phase out up to 750,000. Not knowing your exact situation, you may fall if you're just above 4 there. Again, though, the payroll percentage would be just if you could choose to not offer any more at all and to allow your people to get coverage in the exchange, and you'd have a very small contribution into the pool at that relative to what small businesses pay today.
But I could be faced with the choice of making ends meet, which I barely do now, or having to lay off if I get hit with additional hits under this plan.
Well, I may be missing some of your words, but I thought you had started out saying that you're spending about, we've heard testimony before the committee from other small businesses who are paying in the neighborhood of 15 or 20% today for health care.
That's 15% in general payroll tax. Matching contributions on FICA, etc. I already pay 15% for each dollar, 15 cents on every dollar payroll. This
right. So the point is, if you decided to let your people go into the exchange, you could drop down to 8% or less, depending on the size of your business.
I don't have to pay FICA match anymore, is what you're saying.
What page is it on?
I think you misunderstood again.
I don't know that you can pick up all the questions technically. Maybe we can follow up some by email afterward.
Get an answer for you.
We'll follow up.
Yeah, well, let us
get us the
get that
details on
answer
that.
for you.
So,
Another very significant question. Do you agree with, and this is how I'll just phrase one that I think is from the opposition. Do you agree with giving away your congressional powers to a presidentially appointed advisory board to administer life and death decisions in the Medicare system, it says, but I think there's also generally some other questions about advisory boards for things like fee schedules, which are probably
I don't
more.
favor giving away congressional authority on that issue, period. And I made that argument to the White House, and I made that argument in our congressional committee. I think that the danger here is for those who say you can't ever balance the budget, they miss the point that we did balance the budget in 1996. And I want to say something in fairness. Bush 1 and Clinton took that earnestly, took it up seriously, and we did balance the budget, and we did what had to be done at the time, and it worked. It worked. It worked. And I voted for the plan. It worked.
So there are, I think there are a lot of questions about the cost. There were several that cited the Congressional Budget Office, and one, I'll just pick out a typical one. If the CBO was wrong about the cost of Medicare Part D, why couldn't it also be wrong about the cost of this bill? Again, other things about whether, do we really know how much this is going to cost going in, I think is the gist of the question.
On Medicare Part D, there is a distinction that needs to be drawn here. On Medicare Part D, the people at CBO who were prepared to make a recommendation were shouted down on that issue. I know the parties. You can go back and call that up on the internet for those stories as to how they occurred and how the estimates were drawn. I think from time to time the CBO makes mistakes, but I also think from most of the time the CBO is a pretty good independent scoring agency. I, over the years, have tended to prefer that to the Office of Management and Budget, which I have always thought of as being the executive arm. I tend to like the CBO. There are problems with CBO estimates based on what they include and what they eliminate, and what they won't include in their scoring. And in this instance here, I thought the presentation that they made was helpful to the extent it caused us to go back and redraft plans.
And I should also say that the president, and this is a way to, this is kind of a first test, has said that he will not sign a bill that adds to the deficit. And you will,
Printing money.
Again, for those who are enamored with the status quo, let me tell you, you're going to pay a tax. You're going to pay a tax at higher insurance costs, higher premiums, higher prescription drugs. No, it isn't a false choice. That's not a false choice. We have been, this has been a problem that we have known about for a long, long time, and the deal is that we haven't had the courage or the guts to fix it. We need to fix this. The status quo is broken. The status quo is broken. And if you care about reducing the deficit, if you care about getting the debt down, then you need to
keep what you have.
Right now, healthcare.
I want you to keep it if you like. Keep it.
Right. It is true in the bill. Right now, healthcare costs in this country represent 16% of GDP. It's estimated by the year 2040 it'll be half of our economy if we don't do something. So half of our economy is going to this, and not going to education, not going to tax cuts, not going to deficit reduction, going to health care. You know, we know that for a fact, and therefore we need to fix the system.
Okay, so there's a question
I feel really
with regard to the
because
public
my
option.
My concern is that,
Can we get?
just one moment, because this really goes to this whole thing. My real concern is that
Let's
people,
go ahead. We're gonna,
we
out of fairness, we're going to get you.
compromised to this extent that we are right now. I was for a single-payer health plan. That is gone. This is being
We'll get you an
bought.
index card, ma'am. We'll get you a card. You can write it out. So,
Excuse me?
so there's a question
I've
here
already written it
about
down, and that was
how
the question. But people
independent
like me and other
non-governmental
people
health
in this
care
audience are
going to
over-yelled,
compete with
don't
the
get our concerns addressed, and I would like, and I do, I have a single-payer question that I would like to address.
We're all level playing field here. So the question is, how will an independent healthcare insurance provider, private insurance, be able to compete with the public option?
Yeah,
The
you can't have a real
people
discussion
that,
here.
Did everybody hear the question?
The question is, how will private insurance compete with the public option?
well, most importantly, there are going to be about 47 million people who are going to be buying private health insurance. And these individuals will be, they can compete inside of the public option and inside of the exchange. They can sell their plans. Yes! They can sell their plans.
Working in Massachusetts. Expensive now.
This might be a question people would like. We haven't hit one yet. What don't you like? And I'll let each of you address it. What don't each of you like about the current health care bill? What would you like to see changed?
I'm going to give you kind of a... Pardon? I'm going to give you a candid analysis here, and I think this is something we need to be mindful of. First-class health care is expensive. First-class hospitals are expensive. John O'Brien can tell you about what the cost of technology means. That's where much of health care goes, technology. Stop kidding yourself, that's where it goes. Now, let me just be candid about something here. There is now a very aggressive move afront that everybody in this room needs to be mindful of. And that is that other states across the country have now come to believe